We've been reporting throughout the pandemic about the impact on mental health. And while people in all age groups were affected, a new CDC report shows teenage girls may have been among the hardest hit. 2 on Your Side's Jackie Roberts joins us now to explain and share some critical resources.
This is the report that's received a lot of attention over the last week, showing emergency department visits for suspected suicide attempts among girls in the United States aged 12 through 17 increased 51% during the pandemic. That's looking at February and March of 2021 compared to that same time frame in 2019. While devastating, the news didn't come as a surprise to some mental health experts locally.
We're definitely seeing an increase in calls in general, mainly related to depression, anxiety, and then suicidal ideations.
Valana says there are several reasons for this, with isolation and uncertainty throughout the pandemic being main contributing factors, along with disrupted routines and more time spent online.
Having open communication with your child, checking in on them to see how they're doing, if they're having any struggles with depression or anxiety, or if they're having thoughts to hurt themselves, that's the first step, is asking them how they're doing.
If parents or teens have questions or need help, they're encouraged to call CARES, which supports families in resolving crisis situations.
And then we'll walk them through what resources there are in the community that they can turn to. We can also provide them with that telephone support, or we can come out and do a face-to-face assessment if need be, to assist the family and teach some safety planning and some skills that might be beneficial for the parents as well as the child.
Advocates stress that seeking out counseling is a sign of strength, and it's okay to ask for help.
If somebody breaks their arm, let's say, we don't think twice about going to the hospital to get that arm set. But when we have the emotional equivalent of that kind of injury, we don't often think about seeking out help. And that's where we need to have a shift in our conversation about mental health, because we need to treat our emotions and our mental health the same way that you would treat that broken arm.
For warning signs and resources locally, we'll have links to that information in this story on WGRZ.com. Jackie Roberts, Channel 2 News.